Next topic is formation and utilization of ketone bodies. I have prepared complete note on this topic, and I hope that it will help you to understand. I one by one dictate the same topic so that you can understand. Ketone bodies, all of you heard this name, ketone bodies. There are three different compounds which come under the heading of ketone bodies. The first one is acetoacetic acid, and the second one is beta hydroxybutyric acid, and the third one is acetone. Ketone bodies synthesis take place in the mitochondria of hepatocyte, and synthesis of ketone bodies is termed as or known as ketogenesis. Usually ketone bodies are synthesized when fatty acid oxidation rate is very high. All of you know, I think it is clear that acetyl CoA is basically the end product of fatty acid oxidation, or in other words, we can say that acetyl CoA derived from fatty acid oxidation. There are few steps involved in the synthesis of ketone bodies. The first step is related with the formation of acetoacetyl CoA. It is formed by direct condensation of 2-acetyl CoA, and the enzyme which is involved during this 2-acetyl CoA condensation is ketothiolase. Some of the ketogenic amine also give rise a small amount of acetoacetyl CoA. So there are two different mechanisms by which acetoacetyl CoA synthesize. Now the next step is related with the formation of acetoacetic acid. Again, acetoacetic acid formed by two mechanisms. In the liver, there is an enzyme deacylase which convert acetoacetyl CoA in the presence of water into acetoacetic acid and liberating one CoAsh molecule. The second mechanism by which acetoacetic acid is synthesized is the reaction of acetoacetyl CoA with another acetyl CoA, which will synthesize an intermediate known as HMG CoA. And finally, this HMG CoA will be converted into acetoacetic acid plus 1-acetyl CoA will liberated. This reaction is more complex. The second one reaction is more complex mechanism, but quantitatively it is important. The enzymes which are responsible to synthesize acetoacetic acid by the second mechanism are HMG CoA synthetase and HMG CoA lyase. During starvation, activity of enzyme HMG CoA lyase is very high. Therefore, the formation of acetoacetic acid is also greater or increases during starvation. The basic purpose of all these reactions is to provide sufficient amount of energy when body is under trauma or under such condition when it failed to get any nutrition from the outsource. The third step which is involved is the formation of other ketone bodies. As I said that there are three different compounds which comes under ketone bodies. One is acetoacetic acid, which we have discussed. The second are beta hydroxy butyric acid. Now acetoacetic acid form will give rise to other ketone bodies. In the first reaction, reduction of acetoacetic acid will take place in the presence of NADH2, which will give beta hydroxy butyric acid. And the enzyme which is involved in this reaction is beta hydroxy dehydrogenase. This reaction depends upon ratio of NADH2 and NAD. If the ratio of NADH synthesis of NAD is higher, which is found in the liver during the starvation, then beta hydroxybutyric acid synthesis or conversion will also seems high. The enzyme acetoacetic acid decarboxylation occur to synthesize acetone by the enzyme decarboxylase in the liver. So what will happen? Beta hydroxybutyric acid is synthesized, and as I said that this synthesis is occurring in the liver, and it depends upon the ratio between NADH2 to NAD conversion, as this is required for the synthesis of beta hydroxybutyric acid. And I said that during starvation the ratio of NADH to NAD is very high. So the third ketone body, which is acetone, will be synthesized. Acetoacetic acid decarboxylation occur to synthesize acetone, and the enzyme is acetoacetic acid decarboxylase, which is again present in the liver. Synthesis is taking place where? In the liver. Under normal condition, ketone bodies are completely metabolized, as they are formed in very small amount. So they completely metabolize and eliminated out from the body. Utilization of acetoacetic acid will occur when the rate of beta oxidation is very high. The first utilization occur with the acetoacetic acid. Either of the reactions, there are two reactions by which utilization of acetoacetic acid is taking place. The first reaction in which this component, which is considered as the first ketone body, which is synthesized initially, will react with the succinyl CoA in the presence of enzyme, that is 3-keto-acid CoA transferase, to synthesize acetoacetyl CoA and liberating succinic acid. The second reaction by which utilization of acetoacetic acid is taking place is the reaction of acetoacetic acid with the CoA, and in the presence of ATP, it will synthesize acetoacetyl CoA, liberating 1-AMP and pyrophosphate, that is PPI. The enzyme which is required in this reaction is thiokinase. As I said, the acetoacetic acid synthesis is occurring where? In the liver, but utilization will occur in the kidney, muscle, and heart. Why? Because the enzymes which are required for the utilization and for the conversion are not present in the liver. Okay, students. So, during the utilization of acetoacetic acid, the mainly component which is synthesized by either of the reaction is acetoacetyl-CoA, where acetoacetyl-CoA converted into 2-acetyl-CoA. And during this reaction, 2-acetyl-CoA are synthesized, and the enzyme which is required is beta ketothiolase, where 2-acetyl-CoA utilized in the citric acid cycle, which you have already learned in carbohydrate metabolism. In the second step, utilization of the second ketone bodies, that is beta hydroxybutyric acid, will take place. This ketone body is not actual ketone body because it is not containing any ketone group. It is excreted in the urine if it is synthesized in excess. The third step is the utilization of acetone. Only a small fraction of acetone is synthesized and it is eliminated in urine. It is also present in the breath as due to volatile nature. Some of it give lactic acid. All ketone bodies are oxidized in extrahepatic tissue. They oxidize into glucose, specifically in the brain, whenever glucose level is lower than ketone bodies utilize in the brain to give, not in the brain, but they utilize in the liver, in the muscle, kidney, and heart. And basic purpose of their utilization is to provide immediate fuel in terms of glucose to the brain. All of you must aware that whenever there is low level of glucose found in the body, specifically in the brain, all body mechanism will become shut down due to unavailability of glucose. This is what I already told you when we were taking the regular classes. So acetone or ketone bodies, they will provide fuel to the brain in terms of glucose. When blood ketone level high, its oxidation will become high up to the level of 70 milligram per dl. Okay, students, ketone bodies utilization, as I said, that it depends upon the synthesis of amount of ketone bodies. Under normal condition, whatever synthesized will be utilized. Oxidation of ketone bodies increases until at a blood level of about 70 milligram per dl. They saturate the oxidative mechanism at this level. Under normal condition, oxidation of ketone bodies increases until at a blood level of 70 मिलीग्राम पर डीएल मीन्स इतनी मिलीग्राम पर डीएल जब बॉडी में सिंथेसाइज हो जाती है तो दैट area or that level is basically the saturation level of oxidative mechanism. Any further increase in the rate of ketone bodies formation serves to raise their blood concentration, producing ketoacidosis or ketosis. And when it is excreted in the urine due to the excessive synthesis, we use the term ketone urea. Ketone urea. I'm repeating for your understanding in Urdu कि बॉडी के अंदर कीटोन बॉडीज़ की जो सिंथेसिस है वो एक ख़ास लेवल तक होती है. एक बार ब्लड में 70 मिलीग्राम पर डीएल तक का लेवल अचीव कर जाए, जिसको क्या कहते हैं सैचुरेशन, तो फिर फर्दर इंक्रीज़ नहीं होती. मीन्स कि फर्दर इंक्रीज़ होगी बट एक्सेसिव अमाउंट हो गया ना, एक थ्रेशोल्ड अचीव कर लिया. तो अब ये कीटोन बॉडीज़ जो हैं ये ब्लड के अंदर बहुत हाई हो जाएंगी. तो इसके लिए हम टर्म यूज़ करते हैं कीटोएसिडोसिस और कीटोसिस इन 70 मिलीग्राम पर डीएल से ज़्यादा. तो इसे हम कंसीडर करते हैं कीटोएसिडोसिस. और इस अमाउंट में ज़ाहिर है कि जब बॉडी के अंदर कीटोन बॉडीज़ ज़्यादा सिंथेसाइज हो गई हैं तो उनको एलिमिनेट आउट होना होगा. तो जो चीज़ और जो कीटोन बॉडीज़ एक्सक्रीट आउट हो रही हैं थ्रू यूरिन, हम उसके लिए टर्म यूज़ करेंगे कीटोन यूरिया. अच्छा जी, तो ये दो कंडीशन हो गई, कीटोसिस या कीटोजेनेसिस और कीटोएसिडोसिस एंड कीटोन यूरिया. अच्छा, यूजुअली कीटोएसिडोसिस एंड ketogenesis जो है that is occurring in type 1 diabetes mellitus, as well as it is also associated or result during starvation. Ketosis is the term used when there is abnormal condition in which there is excessive production of ketone bodies in the body, which results in hyperketonemia and ketonuria. Whenever any component or anything increases in its normal concentration, from its normal concentration towards the abnormal concentration in the blood, we use the suffix emia. So in case of increased ketone bodies in the blood, we use the term hyperketonemia, and if it is appearing in the urine, we use the term ketone urea. The most important condition associated with ketosis are severe uncontrolled diabetes mellitus and starvation. In diabetes mellitus, a deficiency or lack of insulin is responsible to a decreased lipogenesis and an increased lipolysis, which results in an increased concentration of fatty acid in the blood plasma. The fatty acid, which are termed as free fatty acid, FFA, okay? The free fatty acid reaches the liver in the excessive amount. As the carbohydrate metabolism is impaired in diabetes mellitus. Keep remember that carbohydrate metabolism is impaired in diabetes mellitus due to lack of insulin. Relatively lesser amount of glycerol 3-phosphate. Keep remember that glycerol 3-phosphate, which is required for the esterification of fatty acid, and this glycerol 3-phosphate is synthesized from where? From carbohydrate. So lesser amount of glycerol 3-phosphates are available in the liver for esterification with the fatty acid to form what? Triglyceride in that organ. Thus, more of the fatty acid which are freely available will now undergo into beta oxidation and producing excessive amount of acetyl-CoA, which then ultimately synthesize ketone bodies. In addition, the tissues of the diabetic patient show a decreased utilization of ketone bodies. Okay, there is decreased utilization of ketone bodies under normal condition, as we discussed that whatever the ketone bodies which are synthesized in a small extent, they must be utilized and eliminated out. But what is happening in the diabetes mellitus? The patient show a decreased utilization of ketone bodies. Therefore, ketosis in diabetes mellitus will result from both an overproduction and an underutilization of ketone bodies. Ketosis is especially seen in type 1 diabetes, which is termed as insulin dependent diabetes mellitus, which occur in young people, or which due to the young people affecting due to this type of diabetes. We can also use another term, that is juvenile diabetes. The ketosis associated with starvation is caused by a decreased availability of glucose as a fuel that lead to an excessive mobilization of depot fat, that is triglyceride, and that mobilization will ultimately metabolize the triglyceride and convert them into free fatty acid and cholesterol. The rate of ketone body formation is increased, but the tissue of a starving person, unlike those of diabetic patient, can utilize the ketone bodies in a normal way. For this reason, the ketosis of starvation is of much lesser intensity than that in diabetes. Is it clear? I hope it is clear. I am repeating that unlike those of the diabetic patient, the starvation can produce the ketone bodies in normal way. This is shown by the fact that the plasma ketone bodies level in starvation rarely exceed 20 milligram per dl, while the level in diabetes mellitus may reaches up to 100 milligram per dl, that is deciliter. The administration of carbohydrate can inhibit ketosis of starvation person. This phenomenon shows that carbohydrates are anti-ketogenic. However, a normal insulin supply is required for this action of carbohydrate. There are other conditions too in which ketosis can occur, that is the high intake of fatty diet, and especially it can be associated with severe prolonged exercise in the children, as well as it can be associated in alkalosis, because severe exercise increase the mobilization of fatty acid from the depot fat, and that may lead to cause ketoacidosis. So here we have finished. There are certain other abnormal conditions in which ketone bodies can increase, but I'm not going into the detail. My basic purpose to give you this lecture is to let you know the importance of ketone bodies, what are these components and how these are synthesized.